Hello, everyone, and thank you for joining us this evening. My name is Karen Brownlee, and I am the Adult Program Coordinator at the North Suburban YMCA. In that role, I bring a variety of programs to adults in our community, including social networking opportunities, donation drives, brain games, and the Adult Education Series, which you are attending tonight. It is my pleasure to welcome you to Illinois Bone and Joint Institute's 10th Virtual Adult Education Series program with the North Suburban YMCA entitled Sidelined by COVID. With the sports world being turned upside down by COVID-19, many parents, athletes, and physicians worry about the effects of this pandemic and what it's putting on young athletes and their sports. Tonight, we are excited to host a panel of experts from IBJI who will share their advice on this topic. Fellowship-trained physicians Dr. Gregory Portland and Dr. Eric Chehab and Athletic Trainer Juliet Barnes will be talking about injury prevention and management, along with the importance of sports recovery in these extraordinary times. Dr. Gregory Portland is a board-certified orthopedic surgeon with an additional certification in sports medicine. He specializes in arthroscopic shoulder and knee surgery, including repair of dislocated shoulders, injuries to the rotator cuff, shoulder tendons, and knee ligaments, and meniscus or knee disc tears. He is the head team physician for Glenbrook North High School and previously has been a team physician for Northwestern University and a medical consultant for Major League Baseball and the National Football League. Dr. Eric Chehab is a board-certified orthopedic surgeon, fellowship-trained in sports medicine. He provides general fracture care and specializes in the treatment of sports-related injuries, and in particular, injuries to the knee and shoulder. Dr. Chehab provides advanced treatments for anterior cruciate ligament injuries, shoulder injuries, including rotator cuff tears and shoulder instability, and soft tissue and bone trauma. He completed his advanced training in sports medicine at the Hospital for Special Surgery, Sports Medicine, and Shoulder Service, where he apprenticed with the head team physician and the medical staff for the New York Giants. He is currently the team physician for Glenbrook South High School. Juliet Barnes is the new assistant facility manager at the Highland Park location of Illinois Bone and Joint Institute. She is an athletic trainer with more than 18 years of experience working in a myriad of sports environments, including Athletico, the U.S. men's and women's national soccer teams, the WNBA Chicago Sky, and has helped a number of local high schools and junior colleges. Juliet also supported Northwestern University's women's lacrosse team for 9 seasons, winning 2 national championships. Juliet earned her master's in sports administration at Northwestern University and her BA in athletic training from Illinois State University. Juliet is passionate about sports medicine, and she understands the importance and critical need for athletes to return to play safely at all levels of the game. Thank you again for joining us this evening. We hope that you will learn a lot about injury prevention and management, as well as sports recovery after being sidelined by COVID-19. Thank you, Dr. Portland, Dr. Chehab, and Juliet for taking the time to be with us today. And now, Dr. Portland, please take it from here.
Thanks, Karen. All right, well, first off, thank you everyone for taking time out of a busy work weeknight to give us the opportunity to discuss this. So as Karen mentioned, my discussion will focus on injury prevention and management during this pandemic. So as we all can agree, at this point, we're all reaching a good bit of fatigue related to the pandemic for the obvious physical and mental toll it's taken on our communities, as well as the disruptions for all of our lives. The impact is widespread, as we all know. I think increasingly, especially for our younger athletes, every month it continues to take an emotional toll on their love, which is competing in organized and individual sports in the community. As we all know, it's completely disrupted all of our work and school flows, and that's why we're on virtual conferences here tonight. There's an increase in home computer use, and tying into the emotional toll is the loss of in-person interaction. It's completely disrupted the normal physical health flow that we have. Athletes, both competitive and recreational, have lost access to the ability to compete, whether it's pickup basketball to varsity games. Gyms have shut down. Access to trainers has either been eliminated or modified significantly. And with many of the schools having virtual class, their daily gym class has been disrupted as well. On a final note, it definitely has had a disruption of medical care, where for a couple months there was almost no easy access to be seen for any athletic injuries. And even today, we're feeling the impact of anesthesia providers, as well as the normal amount of physical therapists that can help rehabilitate patients following their injuries. As mentioned, the usual physical activity with this being disrupted, as well as the normal school, has really caused an increase in keyboard and monitor use. And I'll get to the impact that that has had in a lot of the patients that I'm seeing in my office. Furthermore, a lot of athletes are, I don't want to say winging it, but they're going on the web and looking to do low-cost, easy workouts, which can range from anything from jogging to biking to home boot camps. And this has completely created a whole new genre of injuries that Eric, Juliet, and I are seeing. And then the final thing, which we really don't know, is will there be a spike in injuries as we open up? Just because the traditional injury prevention that a lot of our young athletes have used over the last few years has been altered. So the question is, will we ultimately be seeing more injuries than some other years? So the biggest concern that I have is once we hit February 2021, within a 4 to 5 month period, all of our young athletes are going to be competing basically a year's worth of high school competitive sports and club sports within a 4 to 5 month period. So as we go from 0 to 60, what will happen to these athletes? So the first part of my talk is just talking about potential pitfalls that we're starting to see for overhead athletes. So typically for the young athlete, the typical injuries that we see really occur that as these athletes grow, there's an imbalance in the muscles of their body. This combined with some lax ligaments can often cause the young developing athlete to fatigue. And this is accentuated by a lot of single sport specialization. We now have athletes playing baseball or volleyball year round. And as they play these sports year round, especially as they hit tournaments, we can see these athletes really develop a lot of pain and difficulties with their shoulders. You know, my question I always pose to parents and athletes, and this is a community problem that we all face, is if pro athletes only play 1 game a day, why are young developing athletes playing 3 in a day? So it really shouldn't come as a huge source of surprise if we take time to think about this, that a lot of these young athletes may develop pain. So one new injury that we're seeing increasingly with COVID is what I will call virtual posture. And this can lead to, can be an additional cause of young athletes developing shoulder pain. So with keyboard use, especially as students and even workers, you know, middle age, they often will look down at a computer screen or down at an iPad. And so as a result, what we end up getting is an incredible imbalance in the muscles that traditionally stabilize our spine and our scapular region. These can involve tight muscles that kind of hold our spine to the shoulder blade, as well as having really tight muscles in the front part of our shoulder, especially a tendon called the pec minor. As this hunched over posture continues and as this tightness continues, it can further inhibit some of the muscles that help stabilize our shoulder blade. So we can get a wide range of pain in all these muscles that are hunched over, okay, which can range, as I mentioned, from our paraspinal muscles to different muscles that help stabilize and move our scapula, such as the rhomboids, trapezius, and serratus. It can cause tightness of our pec minor. And furthermore, as this tightness and this abnormal function continues, it will impact those muscles providing compression and stabilization of the shoulder, especially the rotator cuff. So initially we can see where the muscles just get sore, and I think all of us during COVID have experienced this. However, as we get tight and as we are hunched over, these muscles then become weak. So the net result of this is we can have pain, headaches, and weakness of daily life. And then as we go ahead and we return to sport, that these imbalances can give us pain. This is something that increasingly we see as people fatigue with keyboard use. So as people move their shoulders, the normal muscles that pull the shoulder blade muscles back to the spine, as they fatigue, the shoulder blade can stick out. And this can be a source of pain and popping in the patient as they move their shoulder. Now, the biggest concern if we get weak shoulder muscles is that the way our shoulder works is it's a ball and socket joint. And the socket, which is the end part of our shoulder blade, moves in concert with the ball. So if as we play a sport or throw a ball or spike a volleyball, if that socket is balanced underneath the ball, then the amount of force that our shoulder and especially our rotator cuff needs to provide will be the least possible. As our shoulder blade gets weak, where it wants to force the ball off the socket, then that rotator cuff really needs to provide a much larger force. And as it provides this much larger force, it can fatigue. So we not only end up with a situation where we have weakness of the scapular muscles, but also of the rotator cuff as well. So the net impact of this chronic keyboard use is that we get some soreness and tightness of the scapular stabilizer muscles. And then as our activity increases, these stabilizers are at a high risk of fatigue. As these stabilizers fatigue, we need more force to stabilize the joint. And then as the rotator cuff needs to provide more and more force to provide stability, over time this can break down. And those activities that cause the shoulder to go to fatigue, such as repetitive throwing or repetitive spiking of the volleyball, will accentuate this imbalance. So the concerns of the virtual posture initially are tightness and pain, but as we get more weakness, this can lead to rotator cuff pain and even tears, as well as tearing of some of the ligaments that also help provide stability, called the labrum, and this can lead to a loose shoulder. So the treatment of scapular pain or keyboard pain typically is pretty straightforward. It involves a brief period of using an anti-inflammatory and if severe, a mild muscle relaxant. A brief period of physical therapy can be incredibly helpful. A home-directed program can be taught, which can stretch the tight anterior structures of the shoulders, such as the pec minor, strengthen the posterior shoulders or structures of the shoulder blade, such as the rhomboids and trapezius, and can strengthen the rotator cuff. So the goal for every athlete should be start at the crux of the issue, which is have good keyboard posture. Keep the screen at your eye level. Keep your shoulders black or your scapula retracted is the formal way of saying this. And have your forearm supported so that the muscles of your shoulder blade have to work the least possible. It's really critical for athletes as they're going through school and returning to sport to maintain their core power and flexibility of their shoulder blade and their abdominal muscles in this process. And furthermore, it's really critical that athletes be diligent, even though it's much difficult than in normal years, to continue to do the normal training they would do leading up to a sport. So for baseball, it's doing long toss and doing throwing programs, and for swimming, doing dry land training, and other sports can follow suit. So the next quick thing here is we're going to be shifting gears now to the lower body. And the next thing is you know, as we get in this January timeframe where athletes realize that tryouts are coming up quickly, that they need to now get into shape. And what are we going to do in January with all the gyms closed down, but go out and run? So the biggest things that we're seeing now with COVID is the development of knee pain with running, as people have gravitated toward jogging more than any other injuries. And ultimately, the other concern is as people go back to sport, from 0 to 60, like we talked about, where they're probably potentially going to be at higher risk of injuring a ligament called their ACL. So oftentimes when we see athletes come to the office who have knee pain, and the athletes will say, well, I've been running, 5 to 7 days a week, and we recommend therapy to help them, and they feel like they don't need therapy. Oftentimes what we'll do is we'll have them go ahead and do a single leg squat. And the image on the right here shows that as that athlete, if they're really weak and the knee caves in, it can put a lot of pressure on the knee that can give them pain. So the biggest cause of knee pain in a lot of these athletes is gluteus weakness. And similar to that of the shoulder, that as these athletes grow, there is an imbalance in their power relative to the amount of force that they need to stabilize themselves to play a number of sports. And as these athletes are weak in their core and gluteus, they're at risk of developing pain, as well as at risk of injuring their ACL as well as other structures. So with pain in the front part of the kneecap, which is the #1 cause of pain that I see in a young athlete, is that as their gluteus muscle weakens, it causes their knee to cave to the inside, and it causes their thigh bone to rotate toward internally, meaning in a counterclockwise direction for a right knee. And when that happens, it really puts a lot of pressure on the kneecaps that stabilize the kneecap or patella. So oftentimes when people have pain with running, it really is a lot of these stabilizing structures around the kneecap where they have pain. So the net impact of this is as athletes develop pain in the front part of their knee, it can cause a whole slew of abnormal firing, relaxation, coordination of the different muscles of the quadricep. Furthermore, it can cause a decrease in strength that they have, and it completely can cause the nerve fibers that coordinate their motion and the muscles firing to be abnormal. So if we look at people, our young athletes who've developed pain in the front part of their knee, if we look at this, oftentimes these athletes have between a 20 and 40% deficit in the expected abduction force or force in rotating their femur or in moving their thigh bone away from their body. And if there is weakness on one versus the other side, there's a high correlation with pain developing on that knee. And often the good news with this situation, however, is that with a real aggressive therapy directed program of strengthening their hip abductors or their gluteus, then over 90% of athletes can become pain-free within a 2-month period. Furthermore, this is another study that was performed where they looked at knee strengthening versus hip and knee strengthening of people with pain in the front part of their knee. And there was a much better outcome for athletes who strengthen not only muscles about their knee, such as their quadricep and hamstring, but also their core and gluteus muscles as well. So in order to prevent pain, or if we do develop pain, the key is for the athletes to maximize flexibility, which often gets glossed over for these athletes. It's important for them to maintain their core power and maintain their gluteus power. There are even some early studies looking at potentially using Botox to help relax some of these imbalances. And if athletes continue to struggle with this, oftentimes a running analysis can be really helpful as well. So as athletes get back to training for tryouts and returning to sport, the key thing is you do not want to go to muscle fatigue right away. It's critical for athletes to start cross-training and not only working on their cardio, but also their core strengthening and their flexibility as well. I'm going to end my talk here on the biggest concern that I have as these athletes go back to really aggressive sport from having an abnormal flow of training over the last 6 months, and that is having catastrophic knee injuries. And one of the biggest injuries that we see that can be devastating for young athletes is an injury to a ligament called the ACL. And the ACL is a rope that basically connects the thigh bone to the shin bone. And either from being struck or from a knee fatiguing, it can cause the knee to buckle and cause this ligament to rupture. If we look at ACL injuries per age, it is clear that the vast majority of injuries that we see occur in the 13 to 25-year-old demographic. And therefore, all these young athletes who love sport and compete are at the highest risk of injuring this. Furthermore, there are some sports that disproportionately get impacted more than any others. If we look at NCAA data here, from a highest percentage of injuries involve women's sports, namely women's soccer, lacrosse, gymnastics, as basketball. Therefore, it is very common for Dr. Chehab and I to see women tearing their ACLs relative to men at anywhere between a 3-to-1 to 10-to-1 clip. So in a typical year, we'll expect to see over 80,000 high school female athletes tear their ACL. And as I said, the majority of these are soccer and basketball. However, I see every known sport for both men and women where people can tear this. I've even had a swimmer tear their ACL one time. So why do these athletes tear their ACL? Well, it should be noted that the majority of these are non-contact, meaning that as the athlete plants and pivots, that their muscles do not protect them. So these muscles, as they fatigue and are weak to begin with, can cause the knee to buckle. A lot of times these athletes have poor jumping and landing mechanics. Oftentimes these athletes have some loose tissue that does put them at a higher risk. And finally, the single sport specialization does play a role. We also see, for obvious reasons, contact athletes. And as these high school athletes get larger and larger, we get a more powerful, explosive athlete. So we definitely see a higher number of traumatic or contact ACL tears as well. So for injury prevention, there are a number of programs out there, and it's been well shown where lower extremity and core strengthening programs often can lower the incidence of ACL tears by 50 to 60%. And there are a number of studies that have shown this. So my recommendation to athletes is to work with your school trainers if it's for your team. There also exists a number of injury prevention programs up where Juliet is working. We've had an injury prevention program there for years it has really helped a lot of high school and club teams. During this time of COVID, where it's hard to get a group of people together, it may even be beneficial to get a one-on-one physical therapist evaluation to see where your athlete is, to see if they're at risk, where there's some exercises where they can learn a home program to do before returning to their sport. In addition, it's really important for these athletes to be training for their sports as they go. That way they're in good shape as they hit the ground running and competing. And my final bit of advice always, and this isn't just in COVID, but in general, is that athletes really need to be cautious regarding showcases. Oftentimes, athletes won't play for a number of months, and then there'll be a soccer showcase in front of a number of college coaches, and then these athletes play 6 games in a weekend. And unfortunately, it's a recipe for disaster where a lot of athletes get hurt. So I really appreciate everyone's attention, and I hope that both ourselves as older athletes and our children as younger athletes will make it through both mentally, scholastically, and physically during these hard times. And I really appreciate everyone giving me the chance to talk. Thank you.
So Greg, thank you so much for that great talk. And I share your concerns about how we emerge from COVID and going from 0 to 60 and the injuries that can happen. It's hard to imagine that how we've changed so much in just 9 months and our world has been turned upside down. I mean, who would have thought this is how we'd be playing sports with masks on and no crowds, and things have changed dramatically. And these are the fortunate few who can play sports in the sense that they get tested quite frequently. And quite honestly, I think there's the collegiate motive for money that we don't have at the high school level. And we certainly don't have the testing resources that make this somewhat possible to be pulling off. I remember meeting Karen earlier in the pandemic when I was invited to talk about COVID-19 and musculoskeletal injuries. And one of the keys to prevention that I wanted to share was to take care of yourself. And we've been running a program at Illinois Bone and Joint called Ortho Health, where we've been trying to help patients improve their joint health through better sleep, better stress management, through a better diet, and through safe exercise. And these principles that we have applied to patients trying to improve their joint health really apply to all of us at staying healthy during the pandemic. And when we apply these principles of sleep quality and stress management and diet quality and exercise efficiency, what we're trying to do is improve everybody's metabolism. And metabolism is the rate at which you burn energy. And the higher your rate of burning energy, the more efficient your body becomes. And also, we like to think that the more efficiently your immune system can work as well. And so these principles of ortho health, again, are keys to health during the pandemic. But they also might be the key for you as an athlete or your kid as an athlete to improve their athletic performance and prevent injury. And so instead of these factors improving metabolism, you can think of them as a performance enhancer. And so let's look briefly at sleep quality and athletic performance. This was a study that was done out of Stanford about 10 years ago. William Dement is one of the authors of the study, and he's one of the foremost sleep specialists in the country for many years. And they took the Stanford basketball team and essentially extended their sleep. And they extended it by 110 minutes, so for 2 hours. And they followed them for a couple of seasons, and they measured their sprint times and free throw accuracy and reaction times, mood, and sleepiness throughout the course of the season. And not surprisingly, everything got better. So by sleeping an extra 110 minutes, their free throw accuracy improved, their three-point percentage improved, their reaction time got better, their sprint time got better, their mood improved, and their daytime sleepiness went down. And so when you think about sleep and athletic performance, you can sleep to win. You can sleep to be healthy. Here's a great story that was published in Wired magazine. This is one of a former Golden State Warrior, Andre Iguodala, who during college would stay up all night playing video games and then wake up a couple hours later to go to class and then to practice and then do this all over again. And he carried these sleep habits into his NBA career. And he was an all-star NBA player with the 76ers, and then he was traded to the Golden State Warriors. Well, the Golden State Warriors are right down the street from Stanford, and they had hired the sleep specialist who had done that study. And they worked specifically with Andre Iguodala. And they totally changed his sleep habits. And with more sleep, his three-point shot percentage doubled, his points per minute spiked by 29%, and his turnovers and foul rates went down, and he was the 2015 Finals MVP. And when we think about athletes who are performing well beyond their age, we think about Tom Brady and LeBron James, who are really breaking the ceiling of what any athlete has done at their age. They are fanatical about sleep, and they're fanatical about their recovery. And I think if we can help our young athletes develop these habits, both now for their athletic performance, but also for the future, we will really serve them well. And some of the things that kids can do to sleep to win would be, number one, aim for more than 8 hours. And so turning off screens is a really critical part for young athletes to get sleep, for all of us to get sleep. Using an alarm clock and setting a schedule will help you sleep better. Setting a sleep schedule, and make your room a cool, dark cave, making it a dark place without stimulus. Obviously, the kids should avoid caffeinated food and caffeinated drinks. And you have to plan around the early and late practices. As Greg had mentioned, we're going to have a lot of athletes out in the field in a very short time. And there are going to be practices that are early in the morning and late at night. And we have to work with the coaches, and we have to work with the athletic directors, and we have to work with the parents, but most specifically with the athletes, to plan for them to get appropriate sleep. I would argue that a kid who's getting up for a 6 a.m. practice at 5 in the morning, who wasn't able to get to bed at 11 o'clock at night, I'm not sure that practice is going to be worthwhile for them. When we look at stress management, which is one of the other components of our ortho health program, I look at athletes like Ricky Williams, who's shown here. And in the beginning of his career, he was putting up Hall of Fame rushing statistics and numbers. But this is how Ricky Williams would interview. He'd always interview with his helmet on and his visor down because he suffered from a social anxiety disorder. And Ricky Williams was an all-academic football player in the San Diego area, very bright guy. And he just left the NFL because of social anxiety disorder. And if you look at his statistics for his first 5 seasons, and then he left the league, and then he came back to the league and put up these incredible numbers. These 4 or 5 years that were lost to his social anxiety disorder, it really makes you wonder how he could have maximized his potential athletically. This is Kevin Love, who is an all-star NBA player, who's been very forthright about some of his struggles with anxiety. And Kevin Love went to UCLA, and every athlete at UCLA is given the Headspace app, which is a meditation app and a stress management app. And he's a big proponent of that, and he's found that to be very helpful for his performance. And there are other ways to deal with stress. A lot of us turn to exercise for stress, but behavioral therapy, guided relaxation, breathing, going to your breath, yoga, acupuncture, guided imagery, these are all other techniques that can help us manage our stress. Greg and Juliet and I have all seen people who've turned to exercise for stress, overuse it, and then get hurt. And then that really compounds the stress. And so we have to think of some other alternative means of developing stress management tools. Well-managed stress leads to wellness, and it also leads to better performance. And I think this is something that we'd like to pass on to our kids. When we look at diet quality and athletic performance, one of the key features of a good diet for athletics is hydration. And even a small loss of body weight in water can really impair performance. And when you think about our high school athletes who have lunch at maybe 11:30 or 12 o'clock in the afternoon, go out to practice at 3:30 or 4 o'clock, they probably haven't had anything to drink in that time. And I would argue that the majority of high school athletes arrive at practice already dehydrated. And so if we can inform our athletes to prehydrate the hours before, and then drink 10 to 12 ounces with each break, and then rehydrate after, this idea of prehydrating, rehydrating, pre-fueling, and refueling, these are key concepts that our athletes should be taught. And how do you know when you're drinking enough? Well, you can actually use your pee as a bit of a measuring stick just by the color of it. And what about sports drinks like Gatorade? Well, my issue with Gatorade and some of the sports drinks is simply the amount of sugar in them. They have the electrolytes, but they have a ton of sugar just to make them palatable. And most of the time, water works just fine. So when would I recommend a sports drink? Well, typically it's the exception rather than the rule. But if you're aiming for an exceptionally hard workout and need the electrolyte replacement, or you've been unable to rehydrate pre-workout or practice, or for workouts in really extreme heat, and then during tournaments, I also hate tournaments. I think they're just terrible. I think it's torture for the kids, and I know why we do it, but I hate the reason why we do it. But during tournaments in between, it can be quite helpful for rehydration. And this was a study that was done that was picked up on the New York Times, looking at banana and water versus sports drink, and bananas win. And so we do have a low-tech electrolyte replacement, which is usually just food, fruit, and vegetables. Juliet might recognize this. This is from Northwestern and their new athletic facility. And this is the Gatorade Fuel Bar. And they really emphasize rehydration. They talk about pre-fueling before practice with water and a carbohydrate and protein. And then refueling after, where F stands for fluid, C for carbohydrates, P for protein, and A for antioxidants. And this is at Northwestern. They have snacks for the athletes, but these are organized for being closer to practice. So if you're an hour before practice and you need a snack, you'd want easily digestible carbohydrates. If you're a couple of hours before, these are more protein-packed carbohydrates. So they've organized these snacks by the time you have before your practice. So again, this idea of pre-fueling is incredibly important, but how you pre-fuel matters. This is a poster that I took a picture of. This was at the USA Rugby showcase that was at Soldier Field, and Greg and I and others were covering the game. And you could see they recommend 2 hours, fruit and water and electrolytes. maybe a carb rinse. They don't even drink the Powerade. They put it in the mouth and spit it out. Halftime, water, and again, electrolytes. And then afterwards, cherry juice, which is an antioxidant, and carb and protein. This is what they have here. And of course, in classic rugby style, they call it the kill zone. And they also hang the poster with Band-Aids here in the corner. I'm a former rugby player, and so is Greg, so we can relate to this. And so when we think about eat to win, the basics are 3 meals a day, and then pre-fuel and refuel snacks. Eat at least 1 fruit, vegetable, and protein with every meal, and definitely stay away from fast food and processed food. Hydrate. Think of Gatorade and Powerade as the exception and not the rule, and absolutely stay away from sugary drinks such as pop or even fruit juice. This is what a training day meal should look like as a pre-fuel with protein, a lot of vegetables, and a lot of whole grains. Some examples: pasta with chicken and salad, burritos with lots of veggies, meat and veggie sandwich on whole grain bread, or a thin crust pizza with a salad and a big cup of vegetables. What about in the morning? Because a lot of our athletes are going to be pre-fueling in the morning. Eggs make a great one, and they're easy to boil, and you can have them in the fridge. An egg toasted banana fills that criteria of protein, carbs, and electrolytes. Oatmeal, fruit, and nuts. Avocado toast, as seen here. Whole grain waffle and fruit and nuts, or plain yogurt with a fruit and granola. So again, these are some pre-fueling examples. And what about right before practice? Well, fruits make a great one. Bananas, peaches, clementines, apples, or applesauce, or canned fruits if you're in a pinch. And what about after practice? We like to put both carbohydrates and we like to put proteins together. And we like to put fluids back in the body and some antioxidants. So here are some easy examples that kids can pack in their bag to eat after practice within 30 minutes after their activity. And again, the refueling meal looks very much like the pre-fueling meal with lean protein, lots and lots of vegetables, and some whole grains. And finally, I want to talk about exercise efficiency. And the pandemic has spurred a lot of people starting to run, which I think is great, but a lot of people are running and haven't trained and are getting hurt. And I've seen the 2 most common injuries I've seen, and I'm not being totally facetious, are people who started to run and who developed knee pain, and dads who've wrestled their sons and have lost, and they've come in with some sort of injury from their sons. So when we think about performance and injury, we typically want to be in this zone where we have high performance and low injury risk. We don't want to be in this zone where we have a low performance and a high injury risk. And so obviously, if you have good technique, that helps you get into this zone, and poor technique puts you in this zone. But to me, the conundrum is volume, like how much training you do. Because if you don't do a lot of training, if you do low volume, well, that probably reduces your injury risk, at least while you're training, but it certainly doesn't help your performance. And likewise, if you're doing high volume training, I worry that you're going to get in this high injury level as well. So the volume conundrum is a hard one to solve. And so where is the sweet spot for volume? And I'm not sure where it is, but there seems to be growing evidence that high intensity, but very, very short spurts can help. And this was published in the New York Times. It was an exercise regimen called 10-20-30, where basically for 30 seconds, you go very lightly and jog. For 20 seconds, you run, 10 seconds, you sprint. And you do this 5 times, that's a total of 5 minutes, rest for 2 minutes, and then do it again. So really just 10-second sprints followed by a 30-second light jog and 20-second ramp-up run. And this was studied in recreational runners where they substituted this regimen for their usual workout. The first thing is their mileage was halved. In other words, they did much less volume. They had controls in the study, and they did a 5K run as the outcome. And it turns out that the average time fell by over 38 seconds for the 10-20-30 participants, which is really a dramatic improvement in performance. And so I think this speaks to efficiency where you're doing less volume, but getting better results. Here's another example of exercise efficiency. This is a swimmer named Michael Andrews, who's really been on pace to break all of Michael Phelps's records. And he trains in the short burst interval training. He does something called race pace training. And he talks about not doing junk yardage for swimming. I'm absolutely convinced the swim coach who moves to the area, who gets rid of morning practices and lets the kids sleep, has practices that last to 45 minutes to an hour, will transform some of these already very good swim programs into national powerhouses. Because I think these kids do way, way, way too much volume and do not have enough efficiency. And we see these kids and they break down, and I think they break down not just from the volume, but also from the lack of sleep and a lot of the emotional stress that's put on the hours that they put in the pool. And so exercise efficiency, the question, how do you train, comes up. So that's obviously very important. But the other end of this equation is, how do you recover? And so a lot of people we see just have insufficient recovery. They work out like crazy, but haven't really recovered. And then they work out like crazy again, and they haven't recovered from that. And if you start compiling that and compounding that, you can see quite easily why people get injured. This is an Ironman triathlete named Sami Inkinen. And Sami is well-known in the triathlon world because he completely revolutionized training. First of all, he's an entrepreneur. He founded Trulia.com, and he now is the CEO of Virta Health, which is a diabetes management company through artificial intelligence and a web-based platform. But he trains less than 12 hours a week for a race that lasts about 10 hours for the elite participants. And he's focused completely on recovery. And you can read the article in this online and this older version of it. But what he became super conscious about his workouts, that if I don't improve in almost every single workout, it's not because I haven't trained, but it's because I haven't rested. And there was one year I used to get sick a lot. I could go back and totally see the pattern. I wasn't sleeping enough. I felt I wasn't training a lot, but in fact, I was training very hard. And so again, I think this is something that our young athletes, if we can focus their minds on this and maybe take advantage of the silver lining of the kids, maybe resetting some habits, we can help improve their athletic performance. And this is just an example of Inkinen's workouts, which are 60 to 90 minutes for a race that lasts for 10 hours. And when he first started, he was coming in like 100th place. This was before he started focusing on his recovery. When he started focusing on his recovery, he started coming in 10th place, which is really just a dramatic improvement in what's a very highly competitive field. This happens to be my college roommate who's in the Clydesdale division for triathlons, and he's a very, very accomplished triathlete, former Marine. And I was preparing a talk a couple of years ago to a group of triathletes, and I was out of my element. And so I called him or texted him and asked him, and I put this text here. And I think the important thing that he says here, Sami and others have shown that interval necessity increases with age, and absent all the hours and hours to train, go hard every workout, then rest, then repeat. And so these might be, again, I want to emphasize this part, rest, with all of our young athletes, and start putting recovery into their minds just as much as training. And we should think of recovery as sleeping well and eating well and managing stress well. And we want to think of training as exercising efficiently. So I want to thank you also for having me as part of the presentation. And I look forward to Juliet's turn now. I'm going to plug off here.
Thank you, Dr. Chehab. Juliet, I've got a few questions for you when you're ready to join us.
Okay.
All right. And if Dr. Chehab, if you and Dr. Portland could also come back on when you're ready. But these first few questions that I have are for Juliet.
Okay.
So Juliet, can you give us some suggestions for warming up a specific injury in a car or parking lot if you're playing an outdoor sport and you cannot get out on the court until game time?
Sure. So right now we're seeing a lot of athletes and patients in the clinic who've picked up sports that they haven't played before, or outdoor sports then, it's getting a little bit colder out, that we've suggested, for them to keep their car on, the heat on, or get heating pads or, warm patches, to bring TheraBands with them because they're lightweight and easy to travel with, and they can perform their activation exercises. And that'll, again, as Dr. Chehab and Dr. Portland mentioned, that'll reduce the injury, from getting worse or a new injury from coming on. A big thing to make sure as far as warm up goes is that they're doing dynamic stretching. So like the high knees, the butt kicks, side shuffle, back pedaling, and just making sure that they have the appropriate cold attire on. Just like any other sports program, they want to make sure that they're slowly acclimating to this new cold environment, and making sure, with the hard surface, that that the shoes are appropriate, and, the ground could be possibly frozen. So just being more familiar with that type of playing surface. And then again, like any other program, building slowly the duration, their speed, and just the distance if they're doing something like running outside. So I think those are a couple suggestions that I have.
Great, thank you, thank you. Another question was, this is from an older person. As an older individual, what important concerns should I address or focus on when returning to more activity?
Yeah, so with our older, more mature, patients and athletes that are getting active, and with the pandemic having been a little bit more sedentary, a big focus should be on mobility throughout the entire body, with a big emphasis on hip mobility. So making sure that you're slowly returning back to activity, whether it's biking, treadmill walking, again, having the appropriate foot, shoe wear attire, because that's going to be very important with how they're absorbing, the impact in their knees and in their joints. Making sure that they're incorporating a daily stretch routine, balance exercises, and a strengthening program. And I have a couple, exercises here, which I can pull up and show as far as stretches. Okay, so I have my screen up here, and so you can do single leg balance in the corner, making sure you have support to hold on to. Again, for the hip mobility, you can do marching, standing, or seated. Sit to stand, making sure you have good core engagement, working your transverse abdominis, and standing up with your weight shifted distributed evenly between both feet. And then another good one, again, just to help with the hip mobility, leg swings forward and back, side to side, and things like that. So, making sure that with, again, like I said before, with any program or getting into any activity, that you're progressing slowly back into it to prevent any injuries. And the technique, as Dr. Chehab mentioned before, is going to be huge with any of that.
And you had mentioned good footwear. So if I have old gym shoes that I used to use, could I maybe bite the bullet and go out and get some new shoes if my shoes are 5 years old?
Yes, and most, as far as with good shoe wear, you want to go to a shoe place that's going to fit and size your foot. Most good shoe stores, you'll try on about 9 or 10 pair before you put on the right shoe that's appropriate for your foot. Whether your foot, if you have a high arch or a flat foot, you want to make sure that it's an appropriate, shoe.
So do we still break our shoes in like we used to, or should the shoe fit comfortably when you walk out of the store?
The shoe should fit comfortably when you walk out of the store, but eventually, after a while, it'll start to feel more comfortable. But the shoe should fit comfortably when you walk out of the store.
Great, thank you. And with gyms
again,
being closed.
Real quick, sorry to interrupt, but any shoe store that you buy from that you did get sized, they have really good policies where you can probably take the shoe back and, get a different pair. Sometimes they give you kind of a trial period if you need to, see how the shoe is fitting.
Great, thank you. And I was going to ask you too, with gyms being closed, what is the best way to prepare for running outdoors? And the other doctors talked about it a little bit. Can you tell us a little bit more?
So as far as preparing to run outdoors, again, you can do, if you have access to a treadmill, you want to do interval training. And so again, it's all about that acclimatizing to the distance that you're planning on running. So, a run walk sort of routine is most appropriate, and just slowly increasing your speed and then your duration. But at the same token, making sure you have a good program for hip strengthening and lower extremity strengthening. So here on the screen, I have clams, as Dr. Portland had addressed regarding like the glutes. That's a big, muscle group that helps with the impact when you're landing with running. So making sure you're strengthening your glutes and your quads and the lower extremity musculature.
Great, thank you. Thank you. This one might be for Dr. Chehab. The question is, do you suggest any vitamin supplements for student athletes?
So in general, I have a bit of an aversion to supplements in general, because I feel that most of the in fact, all of the nutrients that an athlete needs is there and available in food. But some people do believe in B vitamins as supplements for recovery. When people can't get sunshine and get outside, I do believe in vitamin D supplements. But in general, some of the antioxidants, turmeric as an anti-inflammatory, tart cherry juice is both an anti-inflammatory and an antioxidant. Juliet knows this, at that Northwestern tour, they have a kombucha on tap, and the kombucha is supposed to be very rich in electrolytes and antioxidants. And so, you know, I can't say that I fully understand the nutrition science behind it, but I do know that a well-balanced diet filled with vegetables, and I keep stressing vegetables, is probably the most important way to get the antioxidants, to get the vitamin supplements that you need. And you generally can find everything you need within your diet, and you're using supplements because for whatever reason you're not able to find it in your diet.
And you had mentioned vegetables over and over again. I've heard the saying you should eat a rainbow. You know, if you always just have green beans, that's probably not enough. It should be a variety of fruits and vegetables, correct?
Yeah, what gives the foods their color is the different composition of minerals. And so I absolutely agree. The more colorful your plate in general, probably the more widely you're capturing the necessary nutrition for optimizing your performance and recovery.
Excellent. Thank you. Thank you. Dr. Portland, you mentioned that female athletes tear their ACLs more frequently than male athletes. Can you tell us why that is?
There's a lot of theories as far as why that is, and no one is exactly quite sure. One of the obvious risk factors is just how men and women are made, that women tend to have a little bit wider pelvis than men. So it puts a little more acute angle if we look at kind of the weight going from our body down to the knee, down to the ground. So their knees naturally to begin with are a little more in what we call valgus or knock knee than men's knees. The second thing is that women tend to jump and land a little differently than men. And a lot of the injury prevention programs have really focused on women learning to jump and land more along the lines of how men do, and that's been really helpful. The final thing is just the nature of these tournaments. I think a lot of female athletes, a lot of the men's sports often are contact where it's not quite as much endurance and go to fatigue. And unfortunately, for a lot of the female sports, that these female athletes go to fatigue, and when they go to fatigue, they get hurt. There's probably another 10 things easily that Juliet, Eric, and I could probably name, but I think those are like the easiest to grasp.
Great, thank you.
And
thank you.
And I'll just expand a little bit on that as far as, you know, what Dr. Portland was talking about, especially with the recovery and the fatigue. So getting massages, wearing recovery pants, and doing a good stretching program, but then also doing active recovery. So foam rolling your calves and, you know, IT band out with a lacrosse ball and things like that all go into the plan. And the sleep is a huge, I mean, if anything, that's the most important recovery is the sleep.
Speaking of the sleep, Dr. Chehab, I know that you work with Glenbrook South, and Dr. Portland, you're with Glenbrook North. Are you guys thinking of trying to eliminate those early morning swim practices? I had a swimmer, and you know, getting up and driving him to swim practice at 5 o'clock in the morning was not my favorite thing to do. So I'm wondering, are you guys working on that on these high school athletes or not yet?
Well, I'll take this one briefly, Greg, because it's kind of a landmine. I purposely try never to tell a coach how to coach, but I will try and give suggestions to parents about things to look into and things to research, because there does seem to be a bit of a paradigm shift about how people are preparing for competition. And there's been an emphasis on volume. I mean, it's been no pain, no gain, and these type of things that we grew up with are still around, and they shouldn't be. I mean, there's been pretty clear evidence that the injury risk is much higher. And so I think it's going to take some coach who believes in it coming into the area and then just changing how it's done. But it would be very difficult for it to really happen also because the parents would probably freak about why isn't my kid in the pool at 6 in the morning?
Right.
So it's kind of a double-edged sword.
Got it. Thank you. Thank you. All right. Let's see. Oh, we had a question. Please tell us the many acronyms we see with people who claim to be personal trainers. What are the training differences among these? And I'm guessing you don't know all of them, but and if you want, I can answer that. I know a little bit about it as a trainer. Here's what I would have to say. I've been a personal trainer for 29 years, and I would say talk to the person who's claiming to be a trainer, find out what kind of certifications they have. You can look up those certifications online and really find out what that trainer is planning to do for your student athlete or for you as a client, and ask them questions that are pretty detailed. Compare them to any physical therapist recommendations that you've had or what your doctor's orders have been, and make sure that your trainer is in line with what your goals are and what your professionals have told you in the past. You guys have anything to add to that?
Yeah, as far as, building on that, the team approach is the most important thing. So if they're a high school or collegiate athlete, especially in this area, there's going to be an athletic trainer at that school. So just making sure that that personal trainer, again, different from an athletic trainer, that they're communicating and they can modify exercises as needed. So again, always taking the team approach when it comes to, working with that student athlete.
Great, thank you. Do either of you have anything else to add to that, doctors?
My only advice is, I would just be very thoughtful about what the goal of the training sessions are. I think a lot of the community-based thoughts as far as what we're trying to accomplish aren't always what Eric, Juliet, and I would envision. For us, a lot of these things that are injury prevention make athletes more dynamic and far more productive for whatever they're playing. Oftentimes, one of the big challenges that I see is a lot of athletes, a lot of the weightlifting creates these incredible imbalances that often is a pulled hamstring generator, because the kids get incredibly imbalanced between their core and then their quadriceps and their hamstrings. So I agree with Juliet. It should be a really thoughtful team approach. And most clubs or most high school sport teams often will have people who kind of coordinate things. And if everyone's kind of pulling in the same direction, it'll make it far more productive.
Great, thank you. We had someone else say this presentation is so helpful. Will you be sharing the slides? And yes, this presentation and this question and answer session will be up on the Illinois Bone and Joint website, as well as the North Suburban YMCA's website. Let me see, what else do we have? Oh, I wanted to ask about recovery for older athletes as well. You had talked about recovery for younger athletes, but these younger athletes have parents and grandparents. What are your thoughts on recovery for older adults?
So my thought is it's critical. It's more critical for the older athlete, because the younger athlete recovers very quickly in general. That's what makes them young and why we miss being young, because we don't recover like we used to. But because of that, when I have mature athletes, I will tell them, look, your recovery is critically important, and you want to be fully recovered before your next workout. And I was listening to an interview with Mark Messier, who I didn't realize he's a hockey player, and he was 9 games away from breaking Gordie Howe's all-time games played. I had no idea it was that close. And the interviewer asked him, why didn't you come back for one more season and break the record? And he said, well, I just couldn't recover and play night after night. And then the interviewer said, so why don't you just play every second or third night? Because Mark Messier every second or third night is better than no Mark Messier at all. And he said, well, I just want to feel like one of the guys. And so what was interesting to me about that exchange is that as a mature athlete at the end of his career, he was still acknowledging he could play at that NHL level and still be performing at a level that he's accustomed to performing, but he couldn't do it as frequently. He couldn't recover in time. And so when I think about mature athletes, I really want to emphasize to them to recover. I mean, it's okay to try to run, do it, but please be pain-free and sleep well and eat well and rest and before you go out for your next workout.
Thank you. Anybody else have anything to add to that? Good. That's what I was hoping you would say, by the way, because I work with older exercisers, and my philosophy is no pain, no pain. I want them to be in no pain while they're exercising, and I want them, I don't want any joint pain. So thank you. I was hoping you would say that.
So, when you ask about the trainer, I give a thumb, rule of thumb advice is make sure your trainer is as old as you are. And that's generally a good start.
Yeah, that's a really good point.
For the adult athlete.
Yeah, that's a very good point. Thank you. All right, well, thank you all very much. You guys put in a lot of time for this. We really appreciate the time and effort that all three of you put in, your time this evening to talk with us. These programs have been wonderful. Thank you all three very, very much. And I want everyone to please mark your calendars to join us for the next Illinois Bone and Joint Institute Adult Education Series event on Thursday, January 28th at 7 p.m. It's entitled Neck, Back, and Shoulder Pain, the Most Common Causes, Symptoms, and Treatment Options. So thank you all, doctors and Juliet, this evening. We really appreciate your time. We really appreciate that you put the effort into this, and I hope to see you again soon. Take care, everybody.
Thank you.
Have a good night.
Thank you.